Hi friends, this is Dr. Abdequaem Chimthanawala. Today let us discuss something about Stannum metallicum. Now Stannum metallicum, as you know, a very important remedy for respiratory complaints, chest complaints, and it is beautifully written in a Mater Medica about Stannum metallicum. But I would like to share my experiences which I have got while prescribing Stannum metallicum. Normally, if you see Stannum metallicum, the expectoration of Stannum metallicum in most of the books it is written, it is color white, especially in daytime. And because of that, we always think or relate Stannum metallicum to that white color of the sputum. But in my practice, I have seen different type of symptoms of expectoration of the chest, symptoms of Stannum metallicum, which I would like to share with you. First of all, sometimes the expectoration of Stannum metallicum is greenish, especially in the morning. Now, this is very important to note. Expectoration greenish in the morning. When the patient wakes up from the bed, goes in the bathroom, he expectorate, and the mucus is green in color. That is also covered in Stannum metallicum. In fact, in few patients, you will see the expectoration is yellow in the morning. That is also Stannum metallicum. So don't be only thinking that Stannum metallicum has only that white color expectoration, which is present in most of the patients, but greenish and yellowish also. But in the morning, then Stannum metallicum is indicated. But if the expectoration is white during the daytime, we are not telling morning. If it is white during daytime, then Stannum metallicum becomes a very important remedy. In fact, there are two remedies. One is Stannum metallicum and second is argentum. These two remedies have expectoration which is white in daytime. But if you differentiate argentum with Stannum metallicum has sometimes expectoration greenish or yellowish, especially in the morning. This is very important. And Stannum metallicum has always expectoration which is profuse and chronic. The patient will come and tell you, sir, I have cough and expectorate mucus profusely, and it is very chronic in nature. I take some medicines, I take some antibiotics, I take some other medicine, it is better, but again it is there. It is chronic in nature. So it is chronical in nature. That is important. Now when the expectoration is like this, the taste is also different. So you must remember the taste of expectoration is offensive in case of Stannum metallicum. And one more thing to remember, that is the expectoration in the morning of Stannum metallicum is thick. The patient will tell you, sir, मेरा saliva बहुत क्या बोलते हैं thick रहता है. It is thick in the morning. That is also Stannum metallicum. So these symptoms you have to remember, because there are a variety of symptoms that the patient will come and tell you. So you have to interpret all symptoms and see which remedy is indicated. As we go further, the most important symptom is emptiness. Whenever a Stannum metallicum patient is expectorating, and after expectoration, there is a sensation of emptiness after expectoration. That is a very important indication of Stannum metallicum. That is emptiness sensation in the chest after expectoration. With this, you must remember one remedy which is also very important, that is zincum metallicum. Stannum and zincum metallicum, two important remedies where the patient suffers from emptiness of sensation of emptiness in the chest after expectoration. Of course, there are two more remedies which are have one mark indication, same symptom, that is ruta and caladium. Yes, my dear friends, caladium also has the same symptom as Stannum metallicum and zincum metallicum, that is empty sensation after expectoration in the chest. A very important indication of Stannum metallicum. As you go further, now there is sensation of oppression, and which motion aggravates. There is oppression in the chest, and whenever the patient moves, it aggravates the complaint. That is also Stannum metallicum. And in Stannum metallicum, you have to see there is a pain in the chest. There is a pain in the chest when the patient is talking. A very important indication of Stannum metallicum, that is pain in the chest while talking. Now with this, there are two remedies, in fact 3 remedies that comes to my mind which is important to understand, that is Kalicar, Borax and natrium. These three remedies also have the same symptom, that is pain in the chest while talking. Of course, remedies like tabacums are there, rustox is there, stramonium is there, which are also indicated. But these 3 to 4 remedies like stannum, kalicar, borax, and natrium, important for pain in the chest while talking. I'm just sharing you the clinical symptoms which I have seen in my practice. And you have to understand one more symptom of sternum metallicum, a chest symptom and cough symptom, that is there is a pain in the chest. There is a pain in the chest, rawness after coughing. This word rawness is important because whenever the patient use rawness, we think about causticum. But rawness in throat is causticum. Pain, rawness after coughing in the chest, that becomes sternum metallicum. That is sternum metallicum, or you can say arnica, carbovage, natrium, phosphorus, all have pain in the chest, rawness in the chest while coughing. This is important because you have to have comparative mater medica, so that you have a lot of remedies to compare and then prescribe, so the prescription never fails. After that, the most important symptom which I have seen in sternum metallicum is weakness. I had told you sensation of weakness. Weakness also after expectoration is sternum metallicum. In fact, the most important remedy is sternum metallicum. In fact, weakness of the chest, which it is so weak that the patient cannot talk. It is written impending speech. A very, very important remedy is sternum metallicum. Weakness of the chest, impending speech. With sternum metallicum, you must remember calcarea carb, hiparsulf, sulfur. All these three remedies are very, very important with sternum metallicum. So whenever the patient comes and tells you this symptom, you have to have these 3-4 remedies in your mind. As you go further, sternum metallicum also has weakness in the region of the heart while talking. Weakness in the region of the heart while talking. With sternum metallicum, 2 remedies you should remember, that is calcarea carb and sulfur. Of course, phosphoric acid also. Weakness in the region of the heart while talking. So sternum metallicum, phosphoric acid, these 2 remedies are very important. Important than that also are calcarea carb and sulfur. So in general, in relation to chest symptom, expectoration, the taste, the weakness and the pain, that covers a total of sternum metallicum chest, that you should all remember whatever clinically I have seen in my practice. If you like this video, please do share and subscribe. Thank you.